Everything that I'm saying is, let's see, everything I'm saying is on the website of the Treatment Advocacy Center. The single most important reason they are not being treated is because they think they are not sick. A subset of these untreated, approximately 40,000, are dangerous to themselves or others on any given day. There are suggestions that the problems associated with these individuals are continuing to increase. And finally, the solution is simple: make sure that individuals with severe psychiatric disorders are receiving treatment on it. A rather narrow group given DSM-4. Schizophrenia, schizoaffective disorder, which is simply the between schizophrenia and bipolar disorder. Bipolar disorder with psychosis and major depression with psychosis. These are what we call severely mentally ill. On any given day, there are about 4 million such individuals in the United States. And of those, about 2 million are not receiving treatment. And we now have good evidence where that primary damage is that's associated with the anosognosia. It's in the top area that's hatched there. That bottom area is the cerebellum, as I'm sure you all know. Top area is the inferior parietal lobule, very closely linked with the anterior parts of the frontal lobe. And this is the area that appears to be responsible when you lose insight, when you lose awareness of illness. A subset of these untreated individuals, and I emphasize untreated, there is no evidence that individuals with severe mental illnesses who are being treated are any more dangerous than the general population. Untreated is the key term on this. A subset of these untreated individuals, approximately 40,000, are dangerous to themselves and or others. They account for about 30% of the chronically homeless population. And again, in the handout, there is background information, a summary sheet with the studies on this. They account for about 10%, and that's conservative, of the people in jails and prisons today. Huge problem in the jails on it. Again, in the handout, there is a summary sheet on that. At least 1/3 of them are seriously victimized each year. Between 5 and 10% of such individuals commit a violent act each year. In the European studies, where homicides are far less frequent, the number of homicides committed by severely mentally ill people range from roughly 8 to 19%, depending on the study. In 2005, in the United States, there were 16,000 homicides. Therefore, about 900 of them were attributed to people with untreated severe psychiatric disorders. Family members, especially mothers, small children killed by parents, the Andrea Yates syndrome. And if any of you think that's rare, I might add that when she entered the Texas prison system, there were 69 other women in the Texas prison system who had killed their children on it. In 2003, in 7 months alone, there were 4 more cases in Texas. Finally, last but not least, the solution. The solution is rather simple. Make sure that individuals with severe psychiatric disorders receive treatment. Recognize the importance of anosognosia. Recognize that half of these people do not think they're sick. If you don't think they're sick, there is no reason to seek treatment. Focus services on the subset most likely to be dangerous. Most people with severe mental illnesses are not dangerous. Almost everyone with treated severe mental illnesses is not dangerous. A subset of those who are not being treated are clearly dangerous on it.